Hi, my beauties. Okay, what is Easy Gel? How does Easy Gel work? Is Easy Gel the same as filler? Is Easy Gel right for me? And how long does Easy Gel last? All these questions I'm getting day in and day out in my office about Easy Gel and if it's a safe alternative to filler. We're coming out of this epidemic of overfilled faces and people looking weird and people being very hesitant to do fillers in their face these days, and for a good reason. And Easy Gel may be a safe and effective alternative to filler for those of you who want a revolumizing effect, whether it be in the tear troughs, if you want to volumize your lips without having that overdone look. After watching this video, you'll feel safe and comfortable with more knowledge about Easy Gel to see if this treatment option is right for you. All right, you guys, you ready to get into it? All right, let's dive in. My name is Dr. Stephanie Capel, and I'm a board-certified dermatologist with a private practice in Newport Beach, California. And it is my job to make everyone look and feel their best at every age. And most of my treatments are with lasers or minimally invasive procedures. And the questions that I see in my office usually provide me with topics to discuss on my YouTube channel. And this YouTube channel is non-sponsored, and I don't get paid by any company, and I don't have any paid partnerships. It's just a non-sponsored channel to share information and to educate and empower you guys so that you can make better informed decisions about yourself, treatments you get, and your skin. So Easy Gel is something that we incorporated into our office a little over a year ago. About 1 year ago today, I did an Easy Gel video and kind of talked to you guys about what I saw as a provider and how my patients have been receiving the treatment and if they liked it. And because it was new, I proceeded with caution, and I was very hesitant at first to incorporate this treatment into my practice, but now I'm so glad I have. Because for people who want to avoid filler, whether it's in the tear trough area or especially in the lips for people who don't want that over volumized look or want a safe and natural alternative, Easy Gel has knocked it out of the park with the results and patient satisfaction. And as a provider, I've been so happy to offer this treatment for my patients. Now, I have to go pick up my son from surf practice and my daughter from horseback riding, help them with their homework, make dinner, and then I'll continue this video when I'm back at home with you guys, because the only way I get these videos done is if I balance it with my different jobs that I have in life. And right now I have to go be a mom. All right, see you guys in a second. Okay, you guys, so that took longer than I anticipated. Kids are in bed, the house is quiet, and I'm gonna get this video done. So I'm like in my bathroom, about to go to bed, but I need to finish this video. So to pick up where I left off, I started this video in the office, but I have a high schooler. I can't believe I have a high school freshman now. So I have a high school freshman and I have my daughter who's 11, and I'm like a full-time mom, like not just, you know, a part-time mom, but like a very involved, active mom. And my kids are very involved with different activities, so when I leave work, I usually have to be with them at their activities, make them dinner, help them with the homework, get them to bed, and now I have downtime to make these videos. So a lot of people give me a hard time for, you know, why are you making these videos when you're in your bathroom or laying in bed? But honestly, like, I'm just trying to multitask, and I'm really passionate about educating you guys and sharing information, and I love sharing information about dermatology. So that's why I'm doing this on the fly, like whenever I can carve out the time. And stay tuned until the end of this video where I tell you my secrets and what I do to keep my under eyes nice and smooth and tight at almost 50 years old. So the reason why I'm really excited about Easy Gel is because there's a lot of patients, and I understand why, that have been really shying away from filler. So we're coming out of this epidemic where people were just like looking weird, like celebrities, A-listers, influencers, they're overfilled, they're getting too much filler. And also filler lasts a little bit longer than we had anticipated originally from the clinical trials when it first was launched years and years ago, back when I was a derm resident. And it's sometimes when it doesn't get broken down or metabolized, it can have this change in the consistency and get this fluctuant kind of water balloony kind of look to it, and it can tindle and it can have this weird look. So if that is an issue, we can always dissolve filler and start from scratch. I'm not opposed to filler. I still do filler every day in my office in addition to lasers and all the other treatments we do. But Easy Gel is a great alternative for people who just want to not do filler at all. And I understand patients who don't want to do filler. Although I'm a proponent of filler, dermal filler does have its sometimes setbacks and limitations and complications. And if you really want to go a more natural route by using your own blood products, which we can turn into a filler-like substance that's safe and effective without some of the complications we have to worry about filler, why not? So we use it primarily like for tear troughs, like for the tear trough areas right here. We use it for nasolabial folds, for marionette lines, for just fullness of the face, although Sculptra, which is a biostimulatory filler, is a little bit used more often in this area, but even in the lips, I've been really impressed with lip injections using Easy Gel. So I've had a few patients who don't want to do filler in the lips and they kind of want to add a little fullness or volume, and it's a really beautiful natural look. A lot of people ask me if I have filler or Easy Gel on my lips. I do not. I recently had a lip lift, as you can see if you look at my previous videos. But when you do Easy Gel on the lips, it just gives this puffy, pillowy, beautiful natural look. And it's your own blood products, own growth factors, your own albumin, your protein, and blood products that we take from a blood draw and we process into a filler-like substance. So I would say tear troughs and lips, or anywhere else in your face that you want to do a little bit of revolumizing without over-volumizing, worrying about nodules, worrying about tindle migration, with that overfilled kind of water balloony look. I think Easy Gel is an amazing, amazing alternative. So what is Easy Gel and how is it different than traditional PRP or PRF? Now, PRP just stands for platelet-rich plasma, PRF just stands for platelet-rich fibrin, and Easy Gel is a modification in the next generation of PRF, platelet-derived fibrin. So what we do is we take a blood draw. So we're limited with the amount of product we can produce by how much we can take on a blood draw. So that's like the number one kind of caveat of Easy Gel. The other caveat is it doesn't last as long as filler, but I'll get into that in a little bit. So when we do a blood draw, it's always good to be really well hydrated. So whenever you get a blood draw, whether it's for Easy Gel or just even for medical laboratory work, you want to be very hydrated. So 3 days before your scheduled appointment for Easy Gel, it's good to just drink a lot of water, 2 to 3 liters if you can, and just really hydrate so that we're able to do a blood draw and pull a lot of, not a lot, I don't want to gross you guys out, but as much blood products as we possibly can. And when we spin it down and we process it, we get as much as that of that Easy Gel component that we can. So it's up to you. Hydrate, prepare before your Easy Gel blood draw so that you can get the most out of your product. So it's derived from your own blood products and blood cells and protein. So when you come in for Easy Gel, what does that look like? So usually after the blood draw, it takes about 30 minutes to process the product to make the Easy Gel. And part of the blood products is spun down and the other part is spun a little bit faster. Some is cooled at a certain rate and some is heated and then cooled. And then their products are mixed together. And what that does is it provides a scaffolding and like this filler-like substance that stays in the treatment area. So traditional historical PRP and PRF don't last very long because once it gets injected, it gets circulated away within days and it doesn't last very long. But the way that the blood products are processed, and it's the heating and the cooling and the separation and the adding, it makes it stay there longer with longer lasting effects, which gives a longer lasting result. So traditional PRP or PRF doesn't last as long. The way that the Easy Gel is processed it lasts longer, and it's not because anything is added to it. There's no additives, there's no chemicals, nothing is added to the products. It's just the process in which the blood products are separated and processed in a temperature regulation manner, and then adding them together to make the scaffolding that makes it stay longer. So when I explain this, when I'm lecturing like to the derm residents and the medical students, it's like taking a box of paper clips that are all kind of slipping and sliding on one another. You can pour them out and they can kind of exist in this canister without getting tangled. But if you take the paper clips out and you unwind them and you straighten them out and then you put them back in a box and mix them all together, they're going to be kind of like a scaffold that they're going to be attached to one another, and they're not going to be slipping and sliding and being circulated away. It's also like the way that proteins get changed or denatured or change the molecular configuration with heat and cooling and different temperature variations is very specific. For example, if you take an egg and you break it open and you scramble the egg, you can't unscramble it. You can't get it back by cooling it down after it's been heated or pan fried. You can't put it back in the shell and get it back into that egg yolk and white part of the egg consistency after it's been scrambled. Proteins are made that way and then they can't go back. So there's a lot of influence that you can have with respect to the longevity the distribution, and it's a really cool process to be able to just inject your own blood products and have them actually last and not only revolumize like filler will, but also stimulate and upregulate collagen synthesis, elastin synthesis, cellular renewal, and also not just revolumize, but for example, under the eyes, it brightens the under eyes. So for people who have dark circles, usually you guys who follow me on Instagram know I talk about V-beam laser a lot. V-beam will also brighten up the eyes, but Easy Gel really brightens up the eyes, especially with people who have like dark circles under the eyes from underlying vasculature, or their skin is thinning over time, so they look tired or they look sick, or genetically, sometimes people are just genetically predisposed to having dark circles under the eyes with some, genetic background. So it's really great for brightening that up. So after the Easy Gel is performed, results can last to about a year, maybe even longer. So I think a lot of the studies showed the results that lasted about a year, which is actually a pretty long time. So if you do tear trough filler, it's easier because you just open it out of the box. You don't have to go through a blood draw or drink a lot of water or wait 30 minutes to process the product. And you just open it up and you inject it right into the under eyes, for example, or the lips or wherever you want to inject it. And it usually lasts, especially in the tear troughs, tear trough filler lasts about 2 to 3 years from what I've seen in my patients. Now the studies went 18 months, but anecdotally, I think people get lost to follow-up in clinical trials and they can't study it for that long. But for all intents and purposes, anecdotally in my office, when I do tear trough filler, it usually lasts about 2 to 3 years. But Easy Gel lasts maybe only a year, so it doesn't last as long, but you never have to worry about it going through that weird transient phase where it can change consistency and get kind of like puffy or watery looking or Tyndall. So it does last about a year, which is longer than your traditional PRF. And when we're talking about Easy Gel, it's PRF, not PRP. In my mind and how I've been trained, PRP is more efficacious for anti-inflammatory, for especially in other areas of medicine, musculoskeletal injury, hair restoration, hair growth. That's more PRP. PRF is more for the filler-like substance like Easy Gel. So whether it's Easy Gel, which is just the name of the company that we use the apparatus to process the tissue. It could be any company, but it's usually PRF, platelet-rich fibrin, to make this filler-like substance for revolumizing and rejuvenation effects and aesthetics. Now, when we first started doing Easy Gel, we recommended 3 treatments spaced about 1 month apart for best results. Now, I'm not a provider that likes to do packages. Any of my patients can tell you that, because I want patients to come back because they like a result, not because, oh, well, I have 2 more treatments that I paid for. I don't even think this is working, but I want to come back. I never want to do that. So we don't really do packages in my office, but some offices might. But it is best to do multiple treatments. Now, sometimes patients have 1 treatment and they're super stoked on the results and they don't want a 3rd or 2nd treatment. So I don't want them to feel obligated to come back for 1 or pay for 1 that they don't need. But most people do best after 2 or 3 treatments spaced about 1 month apart. But again, that can vary. It could vary with the severity of the tear troughs. It could vary with the severity of volume loss, their age, how fast they're aging, if they're having a rapid weight loss in a short amount of time. So it's highly variable, but most of the time it does require multiple treatments, and results last about a year. So after 3 treatments spaced 1 month apart, you're at your new baseline, you're loving life, you're loving the way you're looking, and then about a year later you have to come back. Now, whether you need 1 treatment to refresh it or 2 or 3, it all just depends. But I would say 50% of my patients who fly in to see me for this procedure will have it done in a series of 3 treatments, and then I don't see them for maybe a year or 2, sometimes maybe a year and a half. We haven't been doing it that long in my office, and then we just do 1 treatment and it kind of brings them back to where they were before, but also that can vary too. Now, how does Easy Gel work? Easy Gel works by releasing growth factors. So the fibrin, which is part of the clotting cascade, almost like the wound healing cascade, we're kind of inducing a wound healing response in the skin, because that's how we generate collagen and elastin and all those extracellular matrix proteins which are helpful for smoothing and tightening the skin. We're inducing that. So the growth factors that are released are VEGF, which is vascular endothelial growth factor, TGF-beta, PDGF, which is platelet-derived growth factor. There's other growth factors that stimulate collagen and elastin synthesis. There's also fibroblast growth factor. So this whole array of different growth factors that are upregulating extracellular matrix protein synthesis to help smooth and tighten the skin, because all those proteins are downregulated in their synthesis as we get older. Cells become senescent as we gain wisdom and have birthdays. Starting after age 20, and even maybe a little bit before that, your cells start to become senescent. And in science, what that means is it becomes sleepy. Those skin cells, just like your immune cells, your nerve cells, your different cells of your body, start slowing down in their activity and what they do. And in the skin, they make collagen and elastin, and they renew themselves and they restore the barrier. And as you start to lose that, you're upregulating. It's basically biohacking of the skin. You're upregulating through growth factors, the stimulus and the chemical messengers to increase the cellular activity to do what we want it to do with anti-aging benefits. So fibrin also is a part of the blood products portion that provides that scaffolding. And also there's an albumin, which is a protein in the skin that helps provide this gelatinous-like, filler-like gel substance. And without that, you're not going to have like this filler-like substance, because when you look at Easy Gel, when you inject it, the extrusion force through the syringe is very similar to filler. If you didn't have that albumin or that protein that exists in the skin that we kind of extract out through the cooling temperature and heating process, it would just be like this watery PRP that would be injected and would be circulated away. And that's what we did, earlier, like the 2010 era, when it wasn't just lasting that long. And when people first started doing PRP for under eye tear trough fillers and it wasn't lasting, it's because it lacked that albumin component that makes it into that gel-like substance, and it lacked the fibrin, and it didn't have the clotting factors that Easy Gel has that will keep it there and prevent it from being circulated away. So that means your results last longer. In addition, something that the Easy Gel also contains is white blood cells. Now, white blood cells are immune cells. They're gonna come and they're gonna clean up any dysfunctional tissue, any dysfunctional collagen or elastin or cells that aren't working properly. It's like the troops, like the armed troops coming into your skin and just kind of cleaning up the mess and replacing those proteins with healthy, thick collagen fibers and elastin fibers. So, spending years being a skin cancer surgeon, which I no longer do anymore, I spent decades looking at skin under the microscope. When you look at sun-damaged skin, the collagen fibers look different. They're fragmented, they're thin, they're frail, they're broken. The elastin fibers, there's a phenomenon histologically called solar elastosis, where it just has these wispy, purplish, kind of stringy, dysfunctional elastin. But after looking under the microscope for somebody who had Easy Gel, you have thick, healthy pink collagen fibers, and you have healthy blue, beautiful, non-wispy elastin fibers. And clinically what that looks like is the skin goes from wrinkled and textured and thin and weathered to strong and thick and smooth and very youthful. So it's great to see that. I've seen the histological cellular correlation and the clinical correlation, and that's why I'm a big believer in the Easy Gel. And just the results are amazing. Just looking at a patient who walks in after a follow-up, after doing Easy Gel, I'm like, wow, it's really incredible, and the results are very striking. So what effects do we see with Easy Gel? When we inject it into the lips, we see nice, pillowy, plump lips without like the duck situation happening. Your vermilion border stays intact. It just looks very beautiful, almost like you're using like a lip plumper, or actually it's like somebody punched you in the face and like your lips just look swollen. Have you ever like hit yourself in the mouth and like your lips get swollen? You're like, oh, that kind of looks good. I remember when my son, who's now 15, was only 3, he threw like a Hot Wheels and it like hit me in the mouth and my lips got all swollen. I'm like, man, this just looks really good. Then it didn't last, of course, but it's just a very natural looking result. In the face, it's not as substantial as like a biostimulatory filler like Sculptra or Voluma, but it can have beautiful volumizing effects. Under the eyes, chef's kiss. I love Easy Gel for under the eyes. Now we can insert it with either a cannula or with a needle, and sometimes I can ask patient preference, or just based on your anatomy, I can decide which we're gonna do, or sometimes we do a combination of needle and cannula. It just depends on a patient by patient basis. I'm very comfortable doing both, and whoever you're going to for injections should be very comfortable as well. Also, if the Easy Gel gets into the vessel intravascularly, it's not a big deal. Their blood products are supposed to be in your vessels anyway. It's not intentional, but if it does happen, you don't have to worry about an arterial occlusion like you have to do when you're doing filler, which hopefully you don't have to worry about that anyway, because your expert injector should be highly trained and that shouldn't be an issue. But it could happen to anyone, of course. So there's less risk for those complications as well. When injecting the tear trough area, now this is not only just for Easy Gel, this is just for filler injections as well. I guess for the sake of completeness, to restore volume under the eyes, you could do fat transfer, you could do Easy Gel, you could do filler, and then there are some new adipose extracellular matrix enhancing, adipose stimulating products like Renuva, am I pronouncing that right? Yeah, Renuva, that you might be hearing about as well. But as far as tear troughs, I would say the Easy Gel and tear trough filler, the traditional filler, is pretty much the two easiest and most popular treatments for under eye volumization and restoring volume. But it's important when you're going with a cannula to get like the lateral component too, because usually when people think about the tear troughs, they think about like this area right here, but you have to get the whole area. Like when I take, if you're a patient of mine, you know this, I'll take the cannula and I'm going up until the lateral orbital rim right here. If you can see your skull bone on the lateral aspect, that will aid you. When the eyes scan the face, the brain perceives certain things as beautiful, not beautiful, young, old, healthy, sick, and seeing the orbital rim laterally, a lot of injectors miss that area, and I don't know if it's because they don't know how to do it or they just avoiding it because it's a more difficult injection site, or they're just not assessing that area. But you never want to just fill the medial without filling that lateral aspect. That's really, really important. So when we do the Easy Gel, we kind of feather it and fan it along that whole area. Now for some patients, like I said before, we'll use a cannula, sometimes we'll use a needle. If patients are like, I don't want much downtime, I have like a wedding to go to in 4 days, then we'll just do a cannula so you won't have as much bruising, or hopefully little to no bruising at all. Swelling will occur, especially the next day. It's always good to sleep with your head above the elevated above the level of your heart, so sleep on a big fluffy pillow. If you could take a Benadryl if you want for swelling, because it will help minimize fluid retention, especially when you sleep. Sometimes we give patients like a Medrol dose pack, which is methylprednisolone. I try not to give that to patients. I personally don't take it either, because you also don't want to dampen that immune response as well. You want all that inflammation and those inflammatory cascades, because that's those signal transduction pathways and chemokines and cytokines are going to be increasing your cellular activity and how cells talk to one another. And when you do like a steroid or like an Advil, it may dampen that, which there's no real hard data saying one way or the other, but I always say just maybe take a Benadryl, because that will help decrease your swelling, help you sleep better, and it won't really have any counteracting effects to the pathways that we're trying to kick off in the skin to stimulate collagen and for regenerative processes. Now, who's a candidate for Easy Gel? Am I a candidate for Easy Gel? Patients who have like sunken eyes or dark circles under the eyes or fine lines and wrinkles under the eyes. Now, you could be younger with an anatomical predisposition to have dark circles or hollows, then I think that that's a great treatment for you. For someone who doesn't really want to do a laser or a tightening device or Botox, I think for collagen stimulatory effects, I could get right up to the lid margin right here, especially those little annoying fine lines that you get when you smile. Hopefully I don't have them, because I've been doing laser under my eyes for years. That it's a whiz at like erasing those. And so it's really great for that. So anybody who has laxity, fine lines, wrinkles, all of the above, dark circles, sunkenness, sollownness, hollowness, you're a great candidate for it. Who is not a candidate for Easy Gel? Of course, in pregnancy, anybody who's pregnant, and with both of my pregnancies, I try not to do anything. I just don't think it's good to do any procedures during pregnancy, because who knows what effects that it can have. Anybody who's immunosuppressed or immunocompromised, I don't think is a candidate for Easy Gel. Anybody with coagulopathies, platelet disorders, blood dyscrasias, like hemophilia, who have abnormal clotting cascades or any blood diseases, I think that are not, or is contraindicated for Easy Gel. What else am I missing? People with liver issues, because a lot of the coagulation proteins are made by the liver. Albumin is produced by the liver, and it's a key component to Easy Gel. So anyone with liver disease, immunocompromised, blood disorders, and pregnancy, I think are the people who should stay away from Easy Gel. People who are candidates for it, Easy Gel, are pretty much everyone else. So of course, I always, you need to be old enough to have Easy Gel, and if you're 18 and you're an adult, I've never treated anybody that young, but you're off to make your own decisions on your own. I don't think that there really is an age group that I do more Easy Gel in one patient population than others. We do men, women, and people of all ages. as long as they meet the criteria and there's no contraindications. And of course, managing realistic expectations is also very important, and taking before and afters, because when you improve, sometimes it's like watching paint dry. You're not seeing, you're seeing yourself every day, but when you come and you look at your before and after, you're like, man, that looks good. I look a lot better. So what are the downsides of Easy Gel? Well, you need to do a blood draw. So if you're not good with needles or blood draws, that's something you need to think about. Bruising and swelling is always a risk. It is a lot more minimal than filler or other treatments. The downtime from laser could be at about a week, and usually Easy Gel is a lot less than that, but still bruising and swelling are probably the two main side effects. Again, when you use a cannula, that significantly reduces your risk for bruising. You can take bromelain, arnica, avoid blood thinners like omega-3 fatty acids, fish oil, vitamin E, any blood thinning products, aspirin, Advil, and so forth. Wine the night before. You don't want to be ingesting any alcohol before your treatment, because that will increase your risk of bruising as well. And other side effects, not a contraindication or a complication, but a risk or downside of Easy Gel is that it is unpredictable. It's up to you and your body how much you're going to respond to that collagen stimulus effect of it. Some people have one treatment and I'm blown away by how much improvement, how big of a jump in improvement they have with one treatment. Sometimes people, need multiple treatments to get to their endpoint goal or until they're happy. So it's unpredictable how much benefit one person's going to get from one treatment or 3 treatments of the Easy Gel. And it's up to you how hydrated you are and how good your blood's going to behave that day to see how much product we're going to be able to derive from a blood draw. So that unpredictable aspect of it is a downside of Easy Gel as well. The pros of Easy Gel, I think it's all natural, nothing is added. You don't have to worry about the risk of nodules. I've heard a lot of patients ask about, I'm so worried about getting nodules. You cannot get nodules with Easy Gel. As far as I'm concerned, I lecture and go to academic meetings all over the country and even all over the world, and I have never really seen any of my colleagues who are esteemed, dermatologists and in the field of aesthetics have this as a complication. You guys can drop a comment in the comment sections if you've had this experience, but I'm not known to know any nodules happening from pure Easy Gel. It's great that it's an all-natural product. It fades off on its own without changing the consistency or having a change in your result. It just will look like your results are dissipating, and you don't have to worry about it migrating, arterial occlusion, the Tyndall effect where the UV light or the light shines off the product under the skin and has this bluish kind of purple look to it. Really natural looking results too. So I think that the pros outweigh the cons, and again, it's a great treatment option. Now in my office, we provide all sorts of treatment. I'm a laser specialist, so we do a lot of resurfacing lasers, and within the laser categories, you can have ablative, non-ablative, you could have full field, you can have fractionated. There's lots of different options, and with injectables, we can do Botox. You do a lot of neuromodulator underneath the eyes. This is called the jelly roll right here. Infraorbital Botox can do a lot, you guys. You just have to go to an astute provider who understands how to do it, because if you do the wrong amount, the incorrect number of units, or the wrong placement, it can make you look like really weird. You can have an ectropion, and your change of your smile and shelving under the eyes can happen, but that doesn't really happen with any of my patients, and I do it all day, every day, and I love it. I actually do it to myself. I do a little Botox 2.5 units here and here, and it's just like smooths my under eyes. That and lasers, of course. I'm 48 now, but I've been doing lasers under my eyes since I was in my early 20s. More practicing on myself, but inadvertently giving myself anti-aging treatments. But my point is that doing Easy Gel, sometimes in combination with these other treatments, will just knock it out of the park. So surgery can only do so much. A lot of people talk about blepharoplasty. That's usually repositioning of the fat under the eyes. You can do a skin pinch surgically, and that's when they take the skin and they kind of like, do a little incision right here and they pinch the skin. But if you're not a candidate for it, and to be a candidate for a skin pinch, you have to be able to pinch the skin and let it go and have it stay tented. And a lot of people don't have laxity that's that severe, so you don't qualify for a skin pinch surgery. And when you do, and if you do too much, you can get ectropion, where your lid margin doesn't cover the globe of your eye. So, surgery can only do so much. So really it's up to lasers, injectables, things like Easy Gel, resurfacing lasers, tightening devices to help keep the eye rejuvenated, and also using a good under eye serum, which I'm obsessed with. MD Air, my ECM eye serum. This is like my baby. I can't live without this. I put it on 3 times a day. But you know, serums only do so much. They do help. And as far as, you know, this is like eating clean, and office procedures are like going to the gym. So they work well hand in hand together. So you can combine these different procedures and it really gives the best aesthetic outcome. So you can refer to my other videos. We have the new erbium contour TRL laser, which literally, like, I've never seen results like this before. One treatment with this laser and it literally erases under eye wrinkles. You combine that with Easy Gel and you're just crushing it. So I don't care if you're in your 60s, 70s, beyond, if you've never done anything for the under eyes, it's just without fail, just always gives such an amazing improvement under the eyes. So these non-surgical options can sometimes all combine together to synergistically work to improve an area, especially the under eye area. It's kind of like going to the gym. Like a lot of patients will see me for under eye and they'll say, well, what should I do? Should I do Easy Gel? Should I do an erbium resurfacing laser? Should I do Botox? And it's like going to the gym and saying, well, should I do cardio, or should I do the free weights or the machines? Or should I eat clean? Or should I walk on the treadmill? It's just like, well, if you do it all, you're gonna have an even better result. And you may not need all of the different targeted pathways, different mechanisms of action, but the more targeted pathways you get to fix one problem area, that's how you get natural looking results. If you just keep doing the same thing over and over again, you're gonna start looking weird. That's what happen with people with filler. They're not stimulating collagen or like enhancing biostimulatory effects in the skin. They're just passively injecting a bunch of filler, and they're not doing lasers, they're not doing tightening devices, they're just plumping up the skin, and just people just look weird. You got to mix it up and do multiple targeted therapies. And that's the way I practice. Most of my patients look 10 years younger than they are, and like nothing has been done. And it's very natural looking. So I'm a big proponent of Easy Gel. I can't say enough about it. I did a video 1 year ago and it's 1 year later and I've been just blown away, and I can't say enough about it. So drop a comment in the comment section. Hopefully this was useful to you. Share this video with someone else who wants non-sponsored content and information on Easy Gel or filler alternatives that are safe and effective. I hope you guys like this video. Drop a comment in the comment section. Let me know what you want me to talk about next week. Thank you, and we will see you soon. Okay, you guys, this is my Biomat by Higher Dose, and I'm not sponsored by Higher Dose because I'm not sponsored by anybody, but if you guys are familiar with a Biomat, oh my gosh, it's just amazing. It just helps me relax and unwind so that I get sleepy and I go to sleep. My fiance's gonna be home any minute now. He plays basketball until late night and my kids are asleep, and this is the way I unwind and de-stress and get sleepy. Okay, so let's talk about my under eyes. So I've been doing Fraxel Dual or Fraxel Restore on the 1550 nanometer handpiece since I was in my early 20s, because I remember the lecture where they talked about how your skin under your eyes is the thinnest skin on your face, and it's the first to show our age. And even at my young age of like, 24, 25, I started doing Fraxel resurfacing under my eyes, and I've been continuing to do that for my whole life. So I started off doing it once a year, and then, in my 30s, I did it like twice a year. And in my 40s, I started incorporating fractionated CO2. I also do thermage. I did thermage when I was 30, 35, 40, and 45. So I've done it 4 times in my life, and I'll be 50 in a couple of years, and I'll do it then. So I feel like every 5 years doing a thermage of my under eyes and doing Fraxel and CO2 has really helped my under eyes. Also, I've been using under eye serum since I was in high school. My mom always was very big on like having me use even just Aquaphor under my eyes, like starting at a young age. So I never let that skin get dry. I always protected it. I always wore sunscreen under my eyes. And I think that that's been really helpful. Now, I've done under eye filler like in the past, like when I was in my 30s, but I dissolved it. And I haven't done Easy Gel under my eyes because I feel like they're looking pretty good just with lasers and tightening devices, but I'm down to try it. If I need it. But I think that I've been doing lasers and tightening devices for so long, it's not something that I've really needed. And if I could take my own head off and do my own blood draw and process the tissue and the product and re-inject it into my own skin, I would. For under eye dark circles, also I remember when I was in fellowship in my 30s, I did V-beam, and I did a series of 3 treatments spaced 1 month apart because I was having a little bit of like dark circles under my eyes, and I haven't had to do it since. So, I don't feel like I've needed Easy Gel because I've done all these other things. Had I not, I would definitely be doing Easy Gel, and I'll probably still do it in the future. So those are my tricks that I've done for my under eye area. I forgot to mention I do Botox under my eyes. Actually, I don't do Botox, I do Daxxify, which is a longer lasting neuromodulator. So I just do a little bit under the jelly roll right here. It makes my eyes bigger, and then it makes them smooth when I smile. You know, it doesn't wrinkle. So, and it protects that skin. So neuromodulators, tightening devices, lasers, and a healthy lifestyle, and V-beam, and getting plenty of sleep and drinking lots of water, and being on the biomat to de-stress. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.